Questions kind of made to that?
And like what I said, I had two kids. Both of them, during my pregnancy, I was diagnosed with gestational diabetes.
Hi everyone, welcome to our very first podcast. I am Phoebe Costler, a content creator apprentice with HMR Primary Care Academy. Today we're going to be discussing diabetes and I'm here with Delia, who has type 2 diabetes. Would you like to introduce yourself?
Hi, I'm Delia, a mother of two, and like what Phoebe said, here to discuss and hope to give enlightenment regarding type 2 diabetes.
Thank you. I just want to ask about your personal journey, and could you share your story of how you were diagnosed with diabetes and what were the initial symptoms?
Well, like what I said, I had two kids. Both of them, during my pregnancy, I was diagnosed with gestational diabetes. So doctors have advised me to do some tests during the pregnancy. So they've diagnosed that one, and then they have just given me some pointers that there could be a chance that it could be full-blown diabetes at a later stage. So when I have noticed that after my second child, during my maternity leave, I've noticed some symptoms of the diabetes one, excessive thirst, urination, and then hunger, and I had suffered from bad thrush. Mm-hmm. At first, of course, it was acceptance. You already have the idea of what it is all about, but then the acceptance that, am I diabetic? That's the saddest part of it all. But when I have to go and see my GP, have the proper tests done, and yes, they've diagnosed it after taking some blood tests, and then they said let's try to do it first with diet controlled. Mm-hmm. And obviously where I came from, the Philippines, our staple food is rice, which is very high in carbs and everything. So it was difficult. It was difficult at first, but we tried, and I still had a hard time doing it. And they still do the tests and everything. And then after that, after a few tests on medications, titrating this and that, trying this, trying that, they decided I have to go on insulin.
Right. So how did that affect your daily life and management? So how did it impact your daily routine, your meals, your physical activity?
It was difficult because working. I'm a nurse, so I work night shifts, which doesn't help as well because your routine and your body clock affects your diet as well. Mm-hmm. So it's just like when your breakfast is more breakfast, and my breakfast would be at night time. Mm-hmm. So that's quite difficult, and getting used to the diet that you have to follow, or you have to be careful in eating. And with the insulin, sometimes when you go out for a meal, you have to bring your blood sugar, check your machine, and mm-hmm. your insulin as well. The daily routine, it's also difficult with two young kids when I was diagnosed, and you have to be rushing all the time. And the thing is, when you want something to eat, you just grab anything, and just to feel your hunger and
feel better.
Feel better after that one. But like what I say, when I started to be on the insulin, it started to be more aware of the things that are the food that you need to eat, and when you need to eat it, and when you have to check your blood sugars, and when you have to adjust your insulin level. But as of now, the insulin levels are still being kept titrated with my diabetic team as well.
So, what medical and emotional support, if you did have getting it?
They have been I have been seeing the diabetic team for after my GP has referred me to them. Mentally and emotionally, they have been very good. Luckily, mentally wise, because they even offered like, do you need any psychiatric help? Being diagnosed with diabetes, because others cannot really accept it. It's difficult because it's the change in lifestyle, it's the change of with you yourself as well, and to keep an eye on everything, what you're eating, what you're drinking, and things like that, activities of daily living. And with work, it's just, of course, it's difficult. But they have been very supportive. They have been very helpful. And there are a few things that I did, and it's just recording my blood sugars and then keeping a diary of what I have been eating and what I have been feeling on that day, why all of a sudden my blood sugar creeped up. Have I been angry or stressed for, or have I been happy or something? And it does help with that one as well. Yeah.
And what's something you wish people understood more about living with type 2 diabetes?
I guess one thing is it's the complications that the diabetes, it's a long-term illness.
Yeah.
It's something that you cannot say, oh, I've got a fracture.
And it can just be fixed.
Yeah, it can just be fixed. Put a cast on or put a metal bar in. Diabetes is lifelong. It's until you get the complications that in the future that we know, it's stroke, heart disease, eye problems, diabetic retinopathy. So I guess it's for us to know that these can happen in the future, and if we look after ourselves with the help of the community, with the help of the doctors, the GPs, the team, then it's education as well.
Yeah.
It's education.
Is there any misconceptions, so things that people misunderstand about diabetes that you'd want to clear up?
Yes, they normally would say that if you eat loads of sweets, cakes, biscuits, that would add in. But yeah, I mean, it's not a myth or something, but if we eat loads of that, and like me, I'm a bit on the heavy side, so you need to be aware that it adds into your weight, and if you can't maintain that ideal weight for you, it adds into the problem, because you're trying hard to get off on that weight that you've got. So it does. And also, like what they say, diabetes is not, it's a short-term sickness, but it's not. Like what we say, it's a long-term one.
Yeah.
And you don't want to have the complications at an early age.
Yeah. So has there been any community support for you?
Community support, I guess it's mostly with the GP.
Yeah.
Referring you to the diabetic team, which
And where is that? Is that in
Naib?
Oh yeah, in
Yeah,
Rochdale.
Sorry, it's Croft Shifa.
Oh, is it? Right,
Yeah,
okay.
it's
Yeah.
at the Croft Shifa. There's a diabetic team, and they do see you every 3 months or every 6 months, it depends, and then they'll discuss about your medications, and then they'll help you with your insulin, and then in the end they'll just see what's best for you and how it goes. But it would be nice as well if there would be community help with like education activities, like to be more active. Yeah.
Is there any food that you now rely on? So is there any food, like obviously you've changed your diet and everything, so what is the main food that you like to eat now that helps?
I guess definitely with like what I say, with rice being our staple food, it's always there. And our diet, the Philippine diet, is not really as healthy as other kind of diet, but I try my very best to be more vegetables, fruits, I mean, the fruits, like what they say, there's full of sugar in it, but at least it's not
as
much sugar.
Yeah.
It's not those pasteurized sugar like with artificial sugar like you find in cakes, sweets, chocolates, which is also a downfall of myself because I also like sweet chocolates and something. So I guess it's small but often.
Yeah.
And like now with you're scared as well to pass it on to your kids because you have that gene there, you have that thing that it can be passed on to your kids. So being active as well, being and work wise, I mean at work definitely it helps a lot, but of course you feel like, oh, I'm too tired now, too tired to go a bit of walking or something. But there are other means now of getting active. You've got YouTube videos to like a 5-minute walk in the house or something, indoor walking on YouTube, dancing. So you can just do that. I guess those are the lifestyle that
are they like the main exercises that you do to keep fit?
Yeah. It's just to get more active, and sometimes even though you don't get the chance to go outside to do the walking that you need it. I mean, like I say, it can help with that one.
And what advice would you give to someone who's been newly diagnosed with diabetes type 2?
Well, all I can advise is acceptance that this will be a change of your lifestyle. Your adding it like taking your insulin twice a day and giving your insulin blood sugars twice a day. It depends as well. So, and also a change in your lifestyle, diet, activities, and get yourself active and educate yourself as well. And hopefully we just need to realize that it's a lifelong kind of disease, diabetes.
Okay. And what would you say to someone who, like, how can friends and family support someone with type 2 diabetes?
My family has been very supportive, most especially with meals. Yeah, I know it's not that having diabetes, you're not limited with what you have to eat anyway. You can still eat what you want, but not as much as before. Like what I said earlier, it's like small but frequent kind of meals, and it's a variety. There are so many recipes now as well that you can find online, and I mean group wise as well on social media, or even your own family and friends can sort something out whenever. But you just don't like to be singled out, oh, she's got diabetes, or even your friends when you go out, oh, she's got diabetes, she has to have only diabetic meal. So you can also have a variation of any kind of food you want to eat.
And how has living with type 2 diabetes changed your perspective on your health and well-being?
I guess it's just something like what I said. It's I can't accept it definitely at first that I've got diabetes and this is it now. But advancing in medicine and with the way things are going, there could be a time in that kind of treatment that it will be much more easier for us, the diabetic. Like for now, there are some apps that you can just use that so that you don't need to check your blood sugar with the prick of a needle. There's something that you can do that now. But hopefully, it was difficult, but enjoy still. I mean, continue. Continue with your life. You don't need to be cooped up in one. Oh, I've got diabetes, I cannot go out, I cannot do my usual things with my friends, I cannot drink, because they say, oh, you can't drink when you've got diabetes. You can, but like what you said, in moderation. Everything is in moderation. You cannot put a blame on the diabetic patient that, oh, it's you because you've been eating loads of this, you've been eating loads of that. But it's not. It's a disease that we need to have further education and explaining to them why and what caused diabetes, what's the cause of it all. It's not because of this and because of that. It's explaining to most of the people or most of our in the community why there is diabetes and what it is all about.
Thank you for tuning in to today's episode. We really hope you enjoyed it. If you enjoyed it, please share it with others and follow our social media at Rochdale Health Alliance.